Rev-Up office numbers are 572-0383 and 572-0215. Rev-Up St. Lucia, the alpha of radio.
Doctor in the House brought to you the compliments of La Place Salaison, Ultramart, the Library Cooperative Credit Union, and Tapia Hospital.
At Tapia Hospital, caring and competent obstetric consultants who will see you safely from prenatal care through delivery with a team of excellent pediatric and anesthetic support. Tapia Hospital, where the patient safety comes first.
At Library Cooperative Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time, a time when your plans and dreams fall into place, when what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Library Cooperative Credit Union. We're not a bank. We're better.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramart. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today, or check us out on our Facebook and Instagram page. Ultramart, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramart.
It's delicious.
La Place Salaison is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Place Salaison, of course. La Place Salaison, Castries, Groselet, Beaufort, and Soufrière.
It's delicious.
It's now time for Doctor in the House, live on Rev-Up St. Lucia, hosted by Dr. Leonard Surage. Dr. Surage, good evening.
Good evening, Andre. Good evening, listeners. Good evening, viewers. Those who are on Radio 97.1 FM, on Facebook, Instagram, YouTube, and X. We are here every Tuesday, 6 to 7 p.m. And we are doing Doctor in the House. Now, before I have a guest with me, but before I introduce my guest, let me just give you a feel of what we'll be talking about. We're going to discuss a topic which has been requested by popular demand from various listeners. And it is a very common topic. It affects 50% of the population. Can you believe that?
50%?
About 50%.
Wow.
Yeah, of the population. And there is much misunderstanding regarding that particular condition, and some people, and there is equally a lot of science that is available for us to know a little better. Like the English weather, it's always a source of topic, a source of discussion, a source of conversation. And when we find nothing, we blame it. When we don't understand certain illnesses, we blame it on it. So we'll be talking about menopause. It's not a pause for men, but it's menopause. And all the areas that associated with it. And I have with me in the studio a very well-known St. Lucian doctor. She is an obstetrics gynecologist, and her name is Dr. Lucella Charles. Dr. Charles, thank you very much for being here with me and accepting my invitation to come to this program. I appreciate that.
Thank you, Dr. Surage. Thank you for inviting me. Thank you for having me here, Mr. Paul.
Welcome, Dr. Charles. It's good to have you.
Thank you.
Yes.
Welcome.
To open the discussion, what I would first ask is, how would you explain menopause? And I think it may very well be other conditions. Sometimes it's not really menopause, but premenopause. But you'll tell me all about it. So tell me, what exactly is menopause and premenopause?
Okay, so menopause represents a natural expectation for women if we get to that certain point in life. It represents an end of the reproductive period or the reproductive career or the point where we can get pregnant. So we get to a point where there are no more periods, which is its most common sign or symptom, no more periods, and the end of the ability to get pregnant. But for that to happen, we lose things. We lose hormones. Our hormones decline significantly and gives us a break from the periods. I don't think there's any woman who says, oh my God, I've been missing those periods. I think every woman is happy for that point, because our periods as humans are quite frequent and they can be associated sometimes with a lot of discomfort.
Okay.
So the periods end and women are happy. But then because those hormones decline, and those hormones which are responsible for menstruation, they are also responsible for other very good functions. And so some women, not all, can have a very hard, very uncomfortable, sometimes debilitating experience for many, many years during the menopause. So menopause in raw definition is end of the periods. And it has to be a full year in an age-appropriate female, because it cannot be just in any age group. Women who have gone past 40, at least 40, average in the world is 51.
Okay.
But between 40 and 50, 55, most women will start experiencing symptoms until the period ends. So menopause, end of the periods, but with other things associated.
All right. And how often does all women at that particular appropriate age of their life do have symptoms of menopause?
Oh, no. There are many women who will just experience the end of the period. They will say, well, the period's ended and that's that. And they are happy. No more pads, no more having to deal with the blood and the pain or the discomfort. It ends and they're good. But there are women who experience various symptoms. Not every woman experiences a horrible menopause. But the reason why menopause is such a big topic is because there are a lot of women worldwide who are suffering, who are misunderstood, misdiagnosed, and mistreated, as in mismanaged, because of the menopause. And so this is why there's such a massive discussion, because there are women who will have horrible symptoms. There are women who will have mild symptoms, but a lot of women come because their symptoms have reached the point where they cannot even go about their daily lives without something that holds them back. And we can talk about those things.
So what actually causes that now?
Menopause?
No, I mean the horrible feeling.
Okay. So I'll put it down to a little example. We have hormones, all of us, men and women, and the hormones are responsible for a lot of functions. Like, you don't go to sleep just because you close your eyes. Hormones control that. And hormones control things like, your temperature control in your body, as well as the strength of your muscle and your bones. So hormones are responsible for all of those. So we women, we are plugged into all of these hormones that do all of these things for all those years, and we don't think about it, including our menstruation. When menstruation ends, is because those hormones go down. But then they are also responsible for all those other functions that I mentioned. And some women experience that actual, call it unplugging from the benefits of those hormones. So it's like you have a house, like this building you have here, and on one switch, you have all the things attached. So your refrigerator, your stove, your electric fan, everything is on the one switch. And if you turn off that switch, because you just wanted to turn off the overhead lights, everything gets unplugged and everything gets affected. So this is what happens to some women.
So, for example, you said that because those hormones control a number of very important functions, if they are reduced, you said, for example, those hormones may control sleeping patterns, things like that. So for some females, because of the reduction in that hormone, right, they would have problems sleeping. Is that what you're saying?
Sleeping, sometimes to the point where there's zero sleep. for not just a day or not just a week, but for years, for sometimes more than a decade, where women struggle to get restful sleep.
It's interesting you mentioned that, because when you listen to the lay public and you hear about menopause, you think of hot flushes, and that's what most people would know. But the disturbance of sleep was something that I had not actually thought of.
Exactly. And that's just one possible symptom.
One of the
hot
many
flashes,
switches.
the hot flashes are maybe by far the most common symptom, because again, those hormones control internal temperature control, our body control. So most women, the menopause will come and periods will stop and the temperature will still be okay. But there are others, it's like they're on that single switch, and temperature control, sleep, moods, even the ability to remember things. So memory gets significantly affected for some women, whereby it's even troubling. So imagine a woman is still working. In fact, she's just young. She's 48, 49, 50, 51, and she cannot remember some of the things that she was just about to say in a very important meeting. Or
and she can be, and they can jeer at her and laugh at her.
Oh yes, because it's greatly misunderstood, and then of course sometimes people are not even aware that they are going through the menopause because they're still menstruating.
Okay. So the patient may not even be aware that's what's happening.
Exactly. Sometimes the biggest symptom may not be that hot flash, which about 80% of women worldwide experience. And the hot flash can vary anywhere from being mild, a little rise in temperature, to being so hot that women feel that they have just been lit ablaze.
You just said something important. Sorry, Dr. Surage. I'm Joe Public.
You Joe Public.
Yes, you just said something very important. You said that you could be going through menopause and still be menstruating?
Yes, because it's not a single day event. It's a transition. So the menopausal transition is the moment where the hormones start to decline until the periods disappear altogether. And so it can be sometimes for a whole decade, 8 years, 5 years. Women will begin, women may tell you, I noticed something different. Generally it's with the period where they say, well, I find the periods are less frequent, or they come in more frequently. So instead of every maybe 28 or 29 days, the periods are now coming every 18 days or 15 days, and so they're constantly bleeding. Or it may disappear for a month or two and they say, hallelujah, that's it. And then it comes again.
You come back again.
This is why it's very important that women know and physicians know that it has to be a full 12 months. Because if the 12 months have not gone by, this is not menopause. She may have gone
12 months of no period at all.
No periods. Because once that happens,
then you are in menopause.
Then this is menopause.
So all the symptoms you're talking about is before you get to menopause.
Before you get, while you are, and thereafter. So it's not a single day event. It's not just the ending of the periods. It is again the gradual decline in those hormones, because the hormones, they drop, and it's not just a one-day drop. It is over the many years. Some women begin the transition in their 30s, their late 30s. Certain cultures, certain races, like Asians, they sometimes go a little earlier. So by maybe 41, 45, they've already gone into menopause. And you can imagine what that does. So we're talking about sleep and moods and memory, but sex drive.
That's right.
Couples. So women begin to lose interest in sexual intercourse. Already we're not endowed with a full-fledged set of hormones like the men, the testosterone. We have testosterone in high quantities, but our testosterone does not push the sex drive as high as it does for the males. But then that declines. And so women then find that sexual intercourse is not something they want to engage in. Then the health of the genitals, the vagina, the bladder, that also declines, so it becomes dry. Lubrication is less, it's painful. I mean, it's sometimes women find that they're just urinating a lot. They constantly have a bladder infection, and it can just be, again, the transition. And the symptoms vary. So persons, if you pull 100 women, maybe you get 7 out of maybe 70 out of the 100 will say, yes, it was the hot flash. But then others will say, I'm looking back, I was not sleeping. Or I found my moods was very shifty. So women may just find themselves, and you know how they make jokes about us being shifty. We have a right to be, because we are plugged into those hormones which really play on our emotions a lot. But then during the menopause, sometimes there's a massive shift where women may begin to get angry for the slightest.
Yeah.
You just forgot to close the cupboard door, and then she is on the floor in a rage. And you may think...
I can identify with that.
But then it's almost as if you get a flip of the switch. So it's not a situation where a lot of women say they feel they can control. It is only in looking back and getting help, they say, gosh, I have to try so hard. And then it becomes difficult to interact with co-workers and family members and friends, because there's a flip of emotion. Sometimes it's towards the low, where people are very sad, and sometimes with thoughts of suicide. They may not share it, but it happens. Or they get angry so quickly that there's constantly a fight wherever they are, a verbal fight.
So, Dr. Charles, you mentioned about the sex drive.
Yes.
It's in some women, it's less driven.
Yes.
You even mentioned some changes in the vagina and so on.
Yes.
Right. Now, for married couples, that's a big issue, because imagine you have a marriage and your wife is going through menopause from age 31. That decline in the sex drive, is that something that is just for a little while, or it just basically is all downhill?
Generally, it's all downhill, and it's as in does not return, generally. There are women, however, let me say it very quickly, who find that around that period in their lives, they get a boost in their sex drive.
Okay.
So the symptoms, what I want to make clear is that it's not a one set of symptoms for every woman. It varies, which is where we come in as doctors, where we must be very attentive. There are questionnaires we can use to guide us, pull from the patients, because sometimes patients are going around seeing many doctors, and what they are really experiencing is the transition or the menopausal symptoms. So the sex drive, generally when it goes, it disappears. It does not come back, because we don't get those hormones back unless they are replaced.
But not in every circumstance.
Not in every, fortunately.
Dr. Surage, can you identify with that?
It's a hard sell. but what I was thinking of while Dr. Charles was speaking is how many spouses know that. Exactly. And how many general physicians are aware of that level of detail, so that when they are interviewing their patients, they can be a little more sympathetic or understanding. Because I can understand how frustrating it can be for a woman who's going through all that, and the other side realizes
does not understand what's going on.
Yeah. So that's what I was thinking of.
And Dr. Charles, you're also saying apparently these ladies are so frustrated they're going from doctor to doctor, because maybe the doctor that they're seeing does not quite understand what's going on. So let me ask you a very important question. So a lady who's going through that period of menopause, would you highly recommend this person see a professional?
Certainly. I think all women should be seen at some point by a gynecologist. And let me say very quickly, it's not that we gynecologists are all understanding of menopause. It requires a lot of empathy and a lot of self-education.
That's right.
Because there are instances where women come and the symptoms, maybe just recurrent bladder infections, may be a sign of menopause, and it may take a bit before we recognize that. But then there are questionnaires that are available where the patient can come in and fill out her symptoms. But going back to the sex, the libido or the sex drive, a lot of doctors may not be comfortable discussing the issue. I can tell you, female patients are very comfortable discussing their issues when they feel that they are being heard, where they feel that it's a safe space. And they discuss it with partners sometimes. But then it's difficult when persons are in a relationship for a long time and sexual activity was easy, and then it becomes difficult. Then there's, of course, a lot of blame. Maybe you're cheating, maybe you don't like me anymore. And it's difficult for men to sometimes understand that she's just lost the desire. She cares about you, but she's in pain, emotional pain, because she's not feeling. It's confusing her because she may not know what's going on. The vagina is dry, and the vagina requires a lubrication for good sexual intercourse. So imagine a dry vagina, no desire. It's torture. Women are saying, oh my God, I'm in pain. So sometimes they leave the rooms. Sometimes it causes a lot of separation in relationships because the men are having a hard time accepting, and the women are having a hard time being tortured.
Have you ever had to counsel males in that particular situation?
I have tried. I've tried. It's very difficult to counsel males, I must say, in this setting. They say things like, but that's not my sister. But although I've done a few programs and men came up to me and said, Doc, I didn't even realize this thing was so serious. You know, and the males who care, who want to care, who want to learn, they start to, because there's a lot of information available on YouTube, they start to try to understand. But when a man is desirous, he wants sexual intercourse, he loses his reasoning sometimes, I imagine. And then it's really hard. But I think that's where we must tackle it from a community standpoint. Inform each other, educate, because women do not live in isolation. There isn't a planet for women and a planet for men. We live together. And it's very challenging when a woman is saying, Doc, I'm having such a rough time. I just cannot do it. I'm in pain, but I try. And then it just becomes a task for her. And then he knows that it's a task for her. And you can understand where a lot of separation of anxiety in the relationship develops.
Wow.
That's
is
very interesting. Now, for our listeners and viewers, if you want to make a contribution towards that discussion, you can call us on the landline at 572-9710 or WhatsApp at 287-0971.
Let's just give the numbers again. It's 572-9710. That's on the fixed line. WhatsApp is 287-0971. Yes, you can join us at any time. We'll certainly take your calls. But while we're not here to talk about men, right? That's a hard thing for a man to have to accept, that his wife at age 31 has
41.
Well, 40. I'm just saying, it does happen. It does happen. 41 right through has basically lost this desire and so on. This is a very, very, very hard for a man to have to live with and accept.
A man whose desire has not been lost.
Exactly. That is tough.
I'll say, though, we were not given the same libido as men. And that's throughout. So while there are women who have a decent libido, our libido generally is cyclical. It fluctuates. Generally, when we're releasing that egg is when we find the opposite sex. It's a little primitive, a little more interesting. And then that's when women want to engage a little more because it's get towards reproduction. But then most times, if you speak to women honestly, they tell you, I'm okay. I don't need. Women go years without sexual intercourse, sometimes in their youth, in their 30s, and maybe when they get hurt so many times, women give up. And women are very emotional, and rightfully so, because we have those hormones which link us very emotionally.
That's right.
But then when we get to that point where the hormonal drive for sexual intercourse is not there, it is hard. So it's hard for the men, but I'm thinking about the ladies. It's worse.
Wow.
It is worse.
We have a call, Dr. Surage. We have a headphone, Dr. Charles. You can use that.
Okay.
Yes. This is Doctor in the House live on Rev-Up St. Lucia with Dr. Leonard Surage.
Hello.
Hi. Good evening.
Hi. Good evening.
Good
For
evening.
some reason, I'm nervous.
You shouldn't be.
And she's usually not.
Yeah.
I'm usually not. So I am in menopause, but it was something that I guess I would, because I'm a woman. I'll be 49, but I think I was having menopause before I had my surgery. I had surgery for cancer prevention, so I had my uterus, my fallopian tubes, cervix removed. But one of the things that was very concerning to me and a little scary, because I heard everyone was saying, when that happens, you have no desire for sex. So that was like my number one concern. But then I also, and you could correct me if I'm wrong, I also understood that the removal of the ovaries is what causes the vaginal dryness, or the low, like the no
libido.
desire for sex, or the mood changes. But like the doctor said, that actually I guess I'm the lucky one, because for me, I do get the hot flashes. It's not bad. It used to be bad, like I would wet the bed, but it's better. And the sex drive, you don't really feel for sex, but I think because the hormones for sex is not only it's also different type. It's the physical, the emotion, and the touching, and and the circumstance and all those things. I find like if I really put my mind to that and the mood, and then the sexual part comes, and even stronger than before I had my surgery. So I guess I'm lucky. So I just want all the women out there to know is that I think if we think, oh my God, I'm in menopause and I don't feel for sex anymore. But if we really focus on saying that, yes, we don't have this urge for having sex, but if we really put our mind in a different frame of, go in a different frame of mind, like focus on the physical touch and the emotion and all those things, it's a huge difference. And I mean, for the dryness, there are lots of things we can use, that take care of that dryness. But I guess I am one of those women that's actually very lucky that my sex drive is higher than before I had my surgery.
Very good. And
Okay.
I think you're trying. That's the thing. Yeah. Recognizing that there are certain physiological limitations, you actually trying, and that's commendable. And I'm happy that you are sharing all that with the general public. That's good. Thanks for the call.
Thank you. We have another call.
Hello.
Hey, good evening, Andre. How you doing?
Good evening, sir. Thanks for calling.
Yeah, I was going to make a little contribution.
Go ahead, sir.
I just want to join the debate. When it comes to the age-old battle of the sexes, I must put that in open commas. The debates who's more sexually active might be top the list of people who love to argue about it. Understand? Because if the fuel escapades of men or the mysterious allure of women's desires dominate the playing field, after all, men are seen as the pursuers of sex in a relationship, whereas sometimes, women are poised as the ones in charge of it, in charge of allowing it to happen or not to happen. Because they can say yes and they can say no.
That's right.
Understand? But at the end of the day, science, cultures, and egos may all seem to have their say.
Yeah.
But it's not a simple gender game. Because sex drive is complicated and sexual activities have many influences. So the question is, who wants more sex? The male or the female? You understand?
I would tend to say maybe the male.
You see, because that's your opinion.
That's my opinion.
Yeah,
and the male hormones are there all the time. The female hormone varies. We are assuming that.
Have you ever explored the factors that are involved in the people's sex lives and breaking down what is more likely to be more active in the bedroom?
Well, there are other factors to consider too. I mean, not only the hormones, as the doctor was saying earlier on. There are other things that come into play as well as the hormones. So.
But you know what more comes into play, Doc? This the physical attraction that could hijack one's brain.
The physical attraction.
Yeah, that could hijack anyone, the male or the female's brain.
The visual input.
Yeah, exactly.
Yeah.
Because sometimes you find that when you, especially assuming that that this is the guy for me or this is the woman for me, and then not everything is written in black and white. Because you have some. For one thing, you have libido can go up and down, up or down with age for both men and women. You understand? So you have biological influences as well. Men might think they got the ultimate trump card, like the testosterone, and ultimately that could fulfill sexual desires. But that just plays a starting role in driving that. But at the end of the day, when it comes to the main function of the sexual activities, you can have all that within you, and you can even last 2 minutes, you can last 3 minutes. You can even make a wrong, far less half a wrong.
All right.
You understand?
Yes.
So sometimes it is complications, because when you have fluctuations in libido, it is an embarrassment for a man, you know.
Okay,
Yes,
caller.
yes.
We have to take some other calls. Thank you very much for the contribution.
Thanks for your contribution, sir.
We have another call.
Good. Hello.
Hello.
Hello. Good evening.
Hi, Doc.
Hi.
I have a question for the gynecologist.
Okay.
I'm gonna be 56 this year, and I'm still having a period every month. Do you think that's concerning? And I don't think I'm actually having any menopause symptoms per se. I noticed lately I've been getting a little emotional around my ovulation time. I just feel sad. I want to cry, and I don't know why I want to cry. I just lonely and that kind of thing. And for the dryness, I don't know about dryness, but I've not had a discharge in years, like about 6-7 years. I just stopped discharging. I don't have nothing there, and I still having a period every month, and I'm gonna be 56. It's just a question of concern.
There are women who will have early menopause, which is between 41 and 45, and there are women who will have late menopause beyond 51. Some persons go up to 56. A lot of it is based on genetics, as in what your mom or your siblings, your female siblings, have done. So it's not unusual. If you are concerned, however, you can always see a gynecologist. When I do programs like this, I find it very challenging to try to advise persons on personal healthcare issues. The intention is to speak from a broad sense as opposed to speaking directly and doing a sort of a consultation online. So I think it's always good, especially at 56. It's good to see your gynecologist. If you don't have one, we do have a lot of very good gynecologists in St. Lucia.
Why would you need to?
I actually live in the U.S.
Oh, you live in the U.S. Well, see your gynecologist in the U.S.
But if she's seeing a period at 56, why does she need to see a gynecologist? Isn't that a good thing?
It's okay to be seeing the periods at 56. Chances are there are no eggs left and she's on her way out. It's probably just a matter of months or a couple of years, if at most. It's not typical that we see women beyond and closer to the 60th mark. But women must be seen, just like men, at least once a year.
Yeah, I just had a pap smear done over the weekend on my internal. I had a visit with the gynecologist. But the thing is, I'm just tired of the period. That's just what it is.
I know, we get tired of it and we want a break. What we don't want is all the other symptoms that come with some women. And it's very important, and I will repeat, not all women experience horrible symptoms. Some women just get the period ending or the cessation of the menstruation and then they're good. And others get mild symptoms and others get very bad symptoms.
Yeah, I think that's what I think that's going to happen to me, because since I'm still having a period at that age, and no symptoms per se, I think it will just go and do its business and leave me alone.
Hallelujah. I hope it's
Thank you.
the case for you.
Okay. Yeah, we'll have to take a little break at this point in time. But when we come back, Dr. Charles, I'd like you to explain to us, why is it that this is such a relief for the vast majority of women, I imagine, not to see their period? Why is that such a relief? Okay, when we come back.
Okay.
This is Doctor in the House Live with Dr. Leonard Surage, brought to you with the compliments of La Place Salaison, Ultramart, the Library Cooperative Credit Union, and Tapia Hospital.
Tapia Hospital Radiology Department offers 24-hour service. We provide you with X-ray, CT scans, and ultrasound imaging using the most modern equipment that produces the best images for your medical attention. Call the Radiology Unit at 459-2201. Tapia Hospital, where the patient's safety comes first.
At Library Cooperative Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time. A time when your plans and dreams fall into place. When what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Labrie Cooperative Credit Union. We're not a bank. We're better.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramart. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today or check us out on our Facebook and Instagram page. Ultramart, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramart.
It's delicious.
La Plaza Salazar is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Place Salazar, of course. La Place Salazar, Castries, Groselet, Beaufort, and Soufrière.
It's delicious.
This is Doctor in the House live on Rev-Up Slu, hosted by Dr. Leonard Surage. Dr. Surage, it's back to you.
Thank you again, and thank you, listeners, for staying on while we discuss this important topic of menopause. I have with me Dr. Lucella Charles. She is a St. Lucian obstetrics gynecologist working right here. And
so
we were just discussing.
If you mind picking up from where we left off, I was asking a question.
Yeah, well, yeah,
Yes.
I think you had actually posed your question. So
yes,
shall we?
You were asking why?
Yeah, why
I'm
is
so
it that
excited about the periods ending?
not seeing the period and
Mr.
so on?
Paul, every month a woman bleeds for several days of her life. Reproductive age spans from 15, and most of us start prior to 15, all the way up to 44, and we do bleed beyond 44. You just heard a caller say 56. Nobody wants to do that. If you collect all the women, they will tell you, we want to be able to call that period when we are ready to reproduce. It's just too much. It's challenging. There's the blood, and then there's sometimes the pain, and one has to use napkins
The
and sanitary
exhaustion.
things, and it takes away from you physically, the bloating and the mood swings and the dietary change. Some people get tired, some people cannot go to work. But forget all those who have symptoms. Just the mere fact that it's bleeding every month for so many years. No woman wants it.
Mm-hmm.
So we are happy for the break.
Mm-hmm.
Yes. If you had a condition like this, well, a normal thing where you bled every month, you would want to get a break from it. Yeah.
Well, I guess I can never put myself in that position.
Never, no,
Yes.
lucky you.
But I noticed you use the word bleed, blood. Is that correct? Is it bleeding? Is
Yes.
it blood? Or
It's menstrual blood. It's the lining of the uterus, which was prepared as it does every month in preparation for the fertilized egg or pregnancy. And if pregnancy does not occur, then it renews itself. So it sheds its blood for several days, and the quantity varies. Some women will bleed maybe 2-3 days, and others may bleed up to 7 days, 9 days. Sometimes it's heavy.
Mhm.
Yes.
So apart from the loss of the sex drive and so on, what else are women going through?
Great. So I was saying in the background, there are things that women are aware of, like the hot flashes and the sex drive and the dryness, but then the protection of our heart, cholesterol, and our brain, that gets significantly affected in some women. So you've heard it. I'm sure you've heard where women are at a lower risk of heart disease compared to men of the same age, but once we go through the menopause, then we get on par with the men, as in we lose that protection, because these hormones, they protect our brain from strokes and dementia. They protect our heart. The cholesterol levels, it keeps it low, and when we go into menopause, especially if it is not coupled with healthy life decisions and choices, then we are at an increased risk for heart attacks and strokes and dementia. And just learning and remembering. A lot of women going through the menopause will say to you, I seem not to remember the short term, not the long term. People remember everything that was done in years and years ago, but then the short term memory, just trying to remember what I had to do today, or where did I put this key, or what did I come into this room for. It's I think it happens to men as well.
Yeah.
But then women notice it a lot more during the menopausal transition and in the postmenopausal years.
That's extremely important what you just spoke about there. Dr. Surage, I hope you picked up on those things, because she says increased risk of having a heart attack because the hormones are not there to protect the cholesterol levels would obviously increase, and other things that you mentioned.
Increased risk for fractures. Because again, these hormones help with the strength of the bones to help repair bones and build. And when we lose those hormones over time, if it's not replaced either through dietary or hormonal supplements, then women can end up having fractures. And sometimes that's where people end up in bed because they fractured the hip, or they just slid and one little fall and they ended up having a fracture.
Especially in the older population, because there is thinning of the bone, because calcium metabolism, the way the body handles calcium has changed, and therefore most of the women would have taken calcium supplements, etc. That you have to be careful with also. But the loss of calcium in the bone thins the bone, and you'd have thought that it is the big fat people that will have broken bone. Sometimes the thin ones, those ladies with very little weight, so they are the ones that get most of the fractures, and so it becomes a problem. And so that's one thing you have to protect against as they get older, etc.
There's no system which is spared. No system, and it's aging. It's impossible to remain in the same hormonal strength as at 45 or at 55 compared to 21. It's expected that as the body ages, decline will occur in all systems, but it is noticeable in women who are going through menopause. Not all, but some women will say, this is the best time of my life. I feel great, no more periods, no more threat of pregnancy, I'm happy, I'm doing well. And others will struggle to just carry on with their day-to-day activities. And it's these women we have to look out for.
That's right,
and educate the persons around them and treat, manage, because if we don't do that, we run the risk of persons living very difficult lives in silence. Sometimes,
that's right.
Our mothers, our grandmothers did not speak so much. Sometimes women ended up going to the mental institution. Remember Golden Hope? Not because they were mentally unwell, but because they were having very severe menopausal symptoms to do with their psychic, to do with their emotions, and they would scream and cry and tear off their clothes because the heat, the hot flashes were so bad, and it was not well understood.
Not knowing why.
And not knowing why.
Right,
so sometimes they'd attribute it to OBL.
That's right.
Persons come to say they think it's the neighbor that do them something, when it's really menopausal symptoms.
But you still find that now, There are people in the community, in the more remote community, that believe in these things.
Yes.
Yeah. So I think that the education is extremely important, and the science behind it, so that we can understand what's happening to us and appreciate it and deal with it better.
And don't dismiss it, listen, because it's sometimes, we get a bit dismissive. When women come, just this week I saw someone and she said, sometimes I feel as if I losing it, but her symptoms and all the rest of it was, she said, but my co-workers told me it's the menopause. They tell me when you see the doctor, she'll tell you, and she already suspected, because our people now have more access to information. But there were many individuals who were diagnosed as just being, old and crazy, and they were really having bad menopause.
And equally, they have been dismissed as if the empathy is not there. Well, you're just talking, or it's all in your mind, that kind of thing.
Women who go to ER, because the hot flash for some women is not just the heat, but it's they get this aura, they get this pre-hot flash sensation that they are dying. Sometimes it's the heart racing, palpitations. Sometimes they feel almost as if doom, something is going to happen to them, and it's really a hot flash that is coming. It takes them a while to make that association between a hot flash and what happens just before. It's like somebody who gets seizures, or migraines, they may get what is called an aura, where they get that pre-migraine sensation and then they get the migraine. So the same thing happens for hot flash. Sometimes women are asleep and they suddenly fly up because they feel like they're getting a heart attack. Their heart is racing, and it's really the hot flash on its way. Sometimes they run straight into the shower with their clothes on.
Wow. So for the lady who called earlier, 56-year-old,
yes,
can she still get pregnant because she's still seeing a period?
Oh no, not without assistance. She would need external assistance, what is called assisted reproductive technology, because the thing about us, we're born with all our eggs as women, unlike men who make sperm pretty much all their lives. At some point you stop. But we are born with those eggs, and the numbers are vast to start off with, but we lose them in massive quantities. We are meant to ovulate every cycle for those who are functioning well, and at some point we run out of them. So by the mid-40s, most women are down to just a few. Let's give a figure like we may start off with about 20 million eggs when we're a baby in the uterus, and by the time we're about 40, we're probably down to about 1,000.
Whoa.
So it's a vast loss of those eggs, and it's because of the loss, the continuous loss of those eggs. Of course, the eggs, they help to produce those hormones, including the good testosterone, and so when we run out of eggs, we can't get pregnant. So a 56-year-old getting pregnant on her own, unheard of. I'd love to see that. Well, I hope not for her, because it will not be good. Because as we age, our body cannot withstand the demands of a pregnancy. So pregnancy must occur in a young body. So you have women who are in their 50s and getting pregnant, but this is assisted pregnancy. These are in vitro fertilization patients, not just the regular.
So, but having spoken a lot about menopause and the hormones and the system, there are other conditions that can be mistaken for menopause. For example, I think earlier on we were talking about bleeding, and I think that there are cases where the person is bleeding and they thought it was menopause, but it was something else. She may have had. So I want you to discuss with me the other medical problem that you must not mistake for menopause.
So menopause, we use it, we call it a retrospective diagnosis, meaning that it only has to have happened, the 12 months would have had to have gone by with or without the associated symptoms for us to say this is menopause. We investigate women who fall outside of it. So women who are beyond, like before 40, this is called premature, and we investigate to see where the problem is. From brain, thyroid, ovaries, what happened, and to look at therapies as well, because certain therapies, whether it is medication, chemotherapy, surgeries where the ovaries may have been removed or maybe a large portion of the ovary, we need to investigate these women and treat them accordingly, because loss of the hormones means loss of all those good functions that we mentioned, and it can lead to premature death. That's how serious it is. For a woman now who's in the age-appropriate period of her life, we will not investigate, because to do every test, unless she's exhibiting something that is different, then we will look, if it is abnormal bleed, then we examine. So from questioning, which is the history, to examination, and then investigation, certain tests. Pap smear, and I'll make a pitch for pap smear. When you see a pickup in pap smear rate, but there's still a lot of women out there who are afraid to do the pap smear.
Really?
Yes, because passing a speculum is not comfortable. Passing that instrument is not comfortable.
Can you hold your thought, because we have another call?
Of course.
So please, we'll get back to your point. Okay, this is Dr. The House, live on Rev-Up Slu.
Hello. Hello, good evening.
Good evening, Andre. Good evening, Doc.
Good evening, sir.
Good evening.
Good evening, Dr. Charles.
Hi, good evening.
Great lady, great lady. Dr. Charles, I have a simple question for you, and together with Dr. Surage. What name you call when a woman, stop making babies? Like you call it, I know in patois they call it a TL. Like you take out your womb or tie your womb. What name you call it?
Oh, tubal ligation.
It's tying of the tubes and removal of the tubes. But this is surgery. If when a woman stops making babies naturally, it's the end of her reproductive years. But then if she intervenes, then that's one of the interventions we do, where we do, it's permanent, where we tie the tubes, tie and remove.
So why after that the woman can still see her period?
Because her uterus is still there. So the tubes are responsible for the fertilization. The egg and the sperm meets the egg in the tube. So if we cut off that bridge, then she'll still have her eggs, she'll still have influence of the hormones on her uterus, and she'll still have her periods, but the sperm cannot get to the egg. And the eggs don't sit in the belly like big fowl eggs. They're tiny, tiny, tiny little things that just gets absorbed by the body.
Good point.
Yes.
Okay, that's what I wanted to know, because I have somebody who did that thing, and she told me she's still seeing her period. I think she had about 5 children, and then due to circumstances, she made that operation, and she told me she's still seeing her period. And
this is where we come in. We must explain to patients when we do procedures what we're doing, what is expected, because persons sometimes we remove the uterus, for example, say for fibroids, and the ovaries are still there, and women say, but my breast still hurt, and I still feel as if a period is coming. Yes, because they're still ovulating, they're still releasing those good hormones, but then there isn't a uterus, so there'll be no flow of blood. And the blood is not staying in the belly. It's not there because the uterus is not there.
Okay.
So if the tubes are tied, she will not get pregnant, but she'll still get all the other things associated with her menstrual cycle, including her period.
Okay,
caller.
Thank you.
Okay,
thank you.
Thanks for calling.
As always.
Yeah.
Yes.
Yeah, so we were talking about the different conditions, that the medical things that we worry about in somebody who's going through menopause, and not mixing up the two, not missing on these conditions.
Yes, so I said if the patient is prior to age 40 and she's already experiencing, we must investigate. The investigation starts from the mastermind, the brain hormones that control the menstrual cycle. We look at the thyroid, and then we look for external things as well, because we must ask, was she on any medication? Did she have any surgeries? Because sometimes people forget, or they had the surgery, but they did not realize that the ovaries were removed as well.
Okay.
So these women, we want to rule out the cause of the early menopause. For women who go between 40 and 41, it's not unusual, but if they have additional symptoms, we look for other things, because there are many things that can influence the cessation of periods. So it's called amenorrhea if you don't see the periods for 3 months straight. And in a woman who has seen it before, every month, regularly, and for a woman who is not regular, 6 months. If she's missing the periods, then we begin a full-fledged, and it is huge. It's a lot of investigations. So if the lady is age appropriate and the symptoms are classic, then we don't have to do anything fancy.
Okay.
But if she's having an abnormal bleed, then we investigate to see if her abnormal bleed is because of just the shift in hormones versus something else. And of course, we generally look at the entire genital tract, from the vulva, vagina, cervix, uterus, and of course internally.
Okay. Now we've been talking about menopause and the symptoms, etc. And we have also said that there are varying degrees to which it affects the ladies. If it is totally unbearable, are there therapeutic action you can take to relieve the symptoms?
Yes, fortunately. You know, I give I always compare it with a patient who comes in who has had a bad accident and has bled significantly. Blood loss, significant blood loss, is very weak, very unwell, very unstable. What do? We have a blood drive coming up on the 28th of June. What do? Unless that person is opposing, we give them blood.
That's right.
Because we could give them all the fluids in the world. They need blood because blood has a certain function, and unless they get the blood replaced, they will not do well. Same thing for menopause. For women who are experiencing debilitating symptoms, it's because they have lost their hormones. What do they need?
Hormone replacement. Yeah.
Hormone replacement. Now, oh my goodness, let's talk about menopausal hormone therapy, MHT, or HRT. It was formerly called HRT. They've moved away to call it menopausal hormonal therapy, as opposed to just hormone replacement, to target specifically menopausal women. And that's what we need. If we've lost all those good hormones, our heart is racing, we can't even take 2 steps without burning up. Persons are not sleeping, the moods are swinging, the memory is horrible. We should give them hormones. And fortunately, the hormones which are available, and they're available right here on island, and I'll have to say thanks to Dr. Nadia Samuel. Dr. Samuel has been in the background working with the pharmacies, educating, and fortunately we have good hormones on island, which we have given to our patients, and we've seen significant improvement in the symptoms. But there's this terrible fear of the hormones. The first thing persons think is they will get a cancer.
Right. But is that a logical thinking, or it is fear?
It is fear. And it's fear generated by a big trial which came out around the 90s. The Women's Health Initiative trial, massive trial where they looked at over 90,000 women. But then they put out the information very early that, menopausal therapy can cause strokes and heart attacks and cancers. But when years later the study was really fleshed out and looked at in detail, they realized that it had a lot of mistakes. The patient selection was not the best. They chose persons who were older, the type of medication they were using. Women who already were beyond 10 years. For menopausal therapy to be effective, you want to catch that lady in the first 10 years. Preferably if you can get her in the first 5 years. And before she has developed other conditions. And of course, you patient select. You don't just take any woman off the street and say, hey, look, menopausal therapy. You want a woman who you have investigated adequately, whose risks are low, and giving her medication is actually worth far more than allowing her to self-destruct, to wreck. It's like having a vessel that has gone off course and you let it destroy itself because you know what? It's going to happen anyway. That's a big talk. People are saying, but menopause is a natural thing. Yes, it is a natural thing, but in some women it behaves like a disease.
That's right.
I remember years ago I did a program on Satenu. I dared to do a program on menopause in Patois. I speak Patois. I believe I speak good Patois, but it was hard. A lady called and she said, Doctor, malade sa la mauvais ou savent. At the time, in my wisdom, I said, c'est pas malade qui l'a. C'est ça, quoi fait. Well, I was right in some way, but she was also right because her symptoms were really bad. It was behaving like an illness with her.
Once you have pain, discomfort, you have a malade.
It's rough. It was rough for her, and it's rough for a lot of women. So menopausal therapy is safe. Once you select your patient, and your patient is preferably in that first 10 years, it is the best thing you can do for your patient.
That's right.
Rather than leave them. The same thing for pregnancy. Isn't pregnancy a normal process? But there are pregnant women who can develop high blood pressure and diabetes and blood clots and all sorts of things.
That's right.
What has the world done? The world has spent a lot of money trying to predict and to treat and to recognize. This is where obstetricians come in. We see women, the majority of women we see will be all right in their pregnancy. But what about those who will go on to develop? So we want to be able to pick them up early and to treat them. Same thing for menopausal women. So when we have women come to us, we need to put out the questionnaires because they may not all be forthcoming and see while they're in the waiting room if they can go through, and if they need help, you guide them correctly. Because there are some women who will go to a general practitioner or may go to the ENT specialist and have menopausal symptoms.
So in other words, Dr. Charles, what you're saying in simple terms, if some women are experiencing those kinds of symptoms where it makes them feel like they're ill, that there is help.
Yes. Yeah. There is help.
And the help is safe.
And the help is safe. And unfortunately, there are still healthcare providers among us who have doubts about menopausal therapy. And they share that, unfortunately. But if we can keep on helping each other.
That's right.
Sharing information, because there's a lot of information available, and trusting that the medications back then are not the same as now. Now you can apply some gel on the skin or apply. You don't have to swallow everything. You could put a patch on the skin. It can stay there for about twice in the week. You change it, and it really makes a difference. But we must couple that with lifestyle interventions, because as we age, we naturally put on more weight because our metabolism slows down. Everybody knows that. But then we still want to eat the same way. And weight gain is associated with so many other things. So a lot of individuals are in the obese category, and then they also have family members with other things. If you're not exercising, not eating right, you may not be a very, very good candidate for some of those treatments. But I think one of the first steps is to educate, to be aware of correct information, because there's information that is not correct, and to manage self-care, as in mental health care, physical, eat right, exercise if you can, and then to see the professionals so you can get some help.
Yep. So, it has been very interesting. The discussion has been very, very enlightening for most of us. And from the calls, you gather that the message is reaching home. Initially, I used to think that the hormone replacement therapy, that's how we used to call it in the older days, that it was associated with more complications. But from what you are saying, the new research is showing that it's fairly safe.
Oh, yes.
And we ladies don't have to endure all this hardship. And so I think that they should go and see their gynecologist or the general practitioner who will direct them elsewhere. But I think what we are looking for is, as science develops, they are making more demand on quality of life. And the reverse is true, that in aspiring to a higher quality of life, they put more pressure on the science to come up with the answers. And the science is responding to that. And that is why you have much more refined medication, less complications, etc. And we have somebody like Dr. Charles who will come and, in very simplistic terms, tell us more all these things. I really appreciate you coming here and help us this time. I hope I can attract you to come back one other time, just for maybe gynecology or something else.
Okay.
So any last few words you'd like to tell the general public before we close down?
Certainly. I'd say menopause is expected. It's natural. And while many women will have decent experience and be happy for the cessation of the periods, there are women who have symptoms which are very serious and they need help. So please see your gynecologist preferably, or at least a doctor. And for other healthcare providers, let us keep each other informed, keep yourself informed so we can give patients adequate management. Thank you very much for having me here.
Thank you very much for being here.
It was a pleasure having you, Dr. Charles. Thank you. Dr. Surage, as always, thank you for your service.
No problem at all.
This has been Doctor in the House on Rev-Up St. Lucia. Every Tuesday from 6 p.m. to 7 p.m. only on Rev-Up St. Lucia 97.1 FM, and brought to you with the compliments of La Place, Salaison, Ultramart, the Labrie Cooperative Credit Union, and the Tapia Hospital.
At Tapia Hospital, we operate a 24-hour emergency service for all your urgent healthcare needs. Our qualified medical specialist will be on hand to ensure that you receive the best of care. Call us at 459-2617. Tapia Hospital, where the patient's safety comes first.
At Labrie Cooperative Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time. A time when your plans and dreams fall into place. When what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Labrie Cooperative Credit Union. We're not a bank. We're better.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramart. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today or check us out on our Facebook and Instagram page. Ultramat, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramat.
It's delicious.
La Plaza Salazar is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Plaza Salazar, of course. La Plaza Salazar, Castries, Rosalie, Beaufort, and Soufrière.
It's delicious.
Rev-Up St. Lucia is located at Unit 4, Gablewoods Mall, Sunny Acres, Castries, St. Lucia. Tune into us.